Hi, everybody. I'm Chris Flanagan, and welcome to this edition of What's Going Around. Each week, we speak with doctors around the DMV about what they're seeing. It's called What's Going Around, and February is American Heart Month, and today we're talking with Dr. Barbara Cericci, director of the Women's Heart Health Program at MedStar Health, to talk about women's heart disease in particular. And Dr. Cericci, thanks for joining us. Appreciate it. Nice seeing you.
Nice to see you. Thanks for inviting me.
Yeah, you bet. Anytime. It's such an important subject. With heart disease, I think oftentimes many of us think of it as a man's disease, but how does it differ in a woman than a man?
That's a great question. I think that leads to part of the reason why we have these campaigns to make increase awareness that this isn't just a man's disease, it's a woman's disease as well. It may present a little bit differently in women, but I think that that's why we have to be cognizant of this and advocate for the female sex gender in terms of watching and taking care of your heart.
What are some symptoms that may indicate a heart issue with a woman?
So surprisingly, we often think that women present, way differently than men, and to some extent that's true. Men often we think of for classic heart attack symptoms, we think of chest pain, crushing chest pain, and with women, it's interesting because most women when they come in and they tell me about chest discomfort symptoms, they often tell me it's not pain, but they describe things that sound like to another person like it could be pain. Interestingly, over 90% of women who are having heart disease symptoms will often have some sort of symptom associated with their chest. But I think what throws us off is women are just so aware of other symptoms that may be associated with it that we get led off the wrong track. So they may often feel like they're more anxious or they have some stomach issues or some breathing issues. And so it leads us down a different path that maybe we think it's not the heart. But this is very common in women, whereas I think men are often like, no, it's all in the chest, nothing else. So we're more narrowed in that sense.
So, what are some causes in heart disease specifically for women that may differ a bit from men?
So interestingly, women's hearts are smaller than men's hearts, but beyond just being smaller, the way the heart works is a little bit different, which probably explains some of the different symptoms that we may see in women compared to men, and also the types of heart disease that we see in women compared to men. When we think of heart attacks, we think of that classic, blockages in your heart arteries. And that's a common thing that we see when a man presents with a heart attack. When women present with heart attacks, we often will see that they may not have that like occlusion in one of their blood vessels. There may be some narrowing, but maybe not enough. And we kind of think, oh, maybe it's not the heart because it's not completely closed off. But there are other mechanisms that we see more commonly in women for whatever the reason, probably just related to the pathophysiology of a woman's heart compared to a man's heart. But these other kind of things like coronary spasm or vessel erosion or as opposed to just completely closing off the arteries. Those are kind of like other sort of similar conditions, but they can cause similar types of effects as when you're having a heart attack.
And what are some of the risk factors for women, and which women are most at risk for heart disease?
So the risk factors are similar as with men. There's the traditional risk factors, diabetes, high blood pressure, high cholesterol. What's interesting is that when women have these risk factors, it actually increases their risk more than a man for having heart disease. But on top of these traditional risk factors that we think of, women also have additional risk factors often we don't think about, but that are related back to like when they have their pregnancy, if they had high blood pressure during pregnancy, or they delivered early, or they started their periods early, or they had early menopause. These are also additional risk factors that we're recognizing and are becoming more aware of in women that affect their future development of heart disease.
So, if someone does suffer a heart attack, as a doctor, how do you treat a heart attack?
So depending upon the cause of the heart attack, and I mentioned that the most common thing we think of is a blockage in the artery that we want to break open the blockage. Often we use either blood thinners or we put in stents. In women, that may be the case in less than 50% of the cases. And we see these other pathophysiology mechanisms that I mentioned, and we often treat that differently. So we kind of have to tease out what's causing it and then appropriately direct to the correct type of treatment. So not always with stents and blood thinners in that case.
I imagine a healthy lifestyle is a big indicator, but how can
Mhm.
heart disease be prevented?
Well, knowing your risk factors and knowing kind of your family genetics also plays a huge role. And then just being aware, know your numbers, know where you stand in that realm, and then doing something about it. So if you know your cholesterol runs a little high and it runs in the family, you know, eating a healthy diet, choosing the correct type of carbs so that your cholesterol is under control, preventing diabetes. Because, again, as I mentioned, any of these risk factors, which are traditional risk factors in both men and women, in women, it just leads more so to development of heart disease.
And once you're diagnosed with heart disease, I mean, is this reversible? Is it, can you cure it?
So that's a tricky question. Certain again, it depends upon what the etiology is, and oftentimes we say there may not be a specific cure, but we can manage it and at least prevent it from getting worse. So it may whether that be through interventional procedures or through medications, at least being aware and recognizing and knowing what to do when you have those symptoms prevent the development of muscle damage, which is the ultimate goal.
Yeah, great information and so timely. Dr. Sreecher, thank you so much for joining us this afternoon. Just fantastic information.
Oh, thank you for inviting me. Happy to share.
You bet. Thank you.